This segment is sponsored by VCU Health.
The doctor is in and you have questions. Omicron continuing to spread in our community, and many people are considering upgrading their masks to be better protected. Dr. Gonzalo Bearman, infectious disease expert with VCU Health, joins us to talk more about the different types of masks so that we can best understand their protection levels. It's great to see you, Doctor.
Good to see you too. Thank you.
Absolutely. This has been a conversation this entire time about masks. Let's talk about cloth masks, because that is something I read about often, and the level of protection that you're receiving from a cloth mask.
So it's important to say that this has been a dialogue and there's been a kind of an evolution of knowledge, but cloth masks are certainly better than no mask at all. But having said that, cloth masks are not all exactly the same. So we're really looking to maximize a cloth mask by one that's well fitted. It doesn't have gaps around the ears or around the nose, and one that is not just a thin piece of cloth. Cloth masks can actually be used to help or improve the use of a medical mask. So to be worn on top of a medical mask adds an extra layer of protection. So it's really kind of the level of mask use that would probably be best for the highest protection.
And you see different individuals taking that step in a layering fashion. Let's talk a little bit about surgical masks or respirators and what that brings to the equation.
So surgical masks certainly are medical level masks that are higher level than your standard cloth mask. Again, these can be better fitted than most cloth masks. They also have that nasal bridge metal piece that allows for a tighter fit around the nose and the mouth. The respirator mask is really the highest level mask, one that really filters the majority of the air coming into the breathing mechanisms, such that it really provides the greatest level of protection. The thing with a respirator is that it has to be properly fitted to get the maximal benefit. So there are different sizes, including small and regular and even large. An important thing also to know about respirators is that they're used on top of someone who has a lot of facial hair, and they don't get that snug fit, and kind of the value of it is a little bit compromised in that situation.
It's a very interesting conversation, especially when you talk about the protection that the respirators bring to everybody. Which one do you advise the mask providing the most protection?
I think the one that's most accessible and the ones that are easiest to use are going to be the standard surgical mask. Of course, if one chooses to get a K95 or a PFR N95 mask, please make sure that is clearly marked on the outside of the mask, and it's obtained from a reputable retailer or seller of masks, because there are some counterfeit masks out there also. So a surgical level mask is a good mask to opt for.
Absolutely. And what other tips are you sharing with folks so that we can be best protected, Dr. Bearman?
Well, I suggest doubling up with a mask if you're able to do so, either double cloth mask, but better yet, a cloth mask on top of a medical mask. It's still important to continue to wear masks, particularly in crowded environments, and particularly if individuals are already vaccinated yet still have chronic underlying issues. Mask use provides that kind of extra layer of protection to minimize infection from Omicron at this time.
And we certainly have experienced the impact. Thank you so much, Dr. Bearman, for talking with us.
Sure.
For more information, we'll send you to vcuhealth.org so you can learn more. Virginia This Morning returns in just a few minutes.